Hello, dear students. Let us see very important things that you need to remember under misoprostol. So, misoprostol is a prostaglandin E1 analog. So, why we require prostaglandin E1? So, basically, this is the prostaglandin E1 analog. The basic mechanism of action of misoprostol is being the prostaglandin E1 analog. It will going to increase the production and increase the release of what? It will going to increase the production and release of the mucus. So basically it will going to increase the production and release of the mucus, thereby it will going to decrease what? Acid secretion. So where do we use these drugs? So we use misoprostol in the where it is NSAIDs, non-steroidal anti-inflammatory drug, induced ulcers. Which ulcers? It is gastric ulcers. So basically we're going to use in the peptic ulcer disease. And also it has been tried, and it is the specific drug of choice in the treatment of smoking induced peptic ulcer. This has been also used where? For induction of labor. To ripen the cervix, we use misoprostol. Induction of labor. So these are the uses. So what is the side effects? So please remember, side effect will be the diarrhea. It will cause more commonly diarrhea, and it is contraindicated in the female who is in the child bearing age group. So just to summarize, so misoprostol is a prostaglandin E1 analog. The mechanism of action of misoprostol is being a prostaglandin E1 analog. It will going to increase the production as well as the release of the mucus, and simultaneously it will going to decrease the acid secretion. So where do we use? So since it is decreasing acid secretion, we can use it in case of NSAIDs induced peptic ulcers, smoking induced peptic ulcer. It is a specific drug, but the drug of choice will be the proton pump inhibitors. It can also be used in the induction of the labor, and side effect encountered with misoprostol is the diarrhea, and one contraindication is you should be careful. Misoprostol should not be administered in the females who are in child bearing age group. So why do we use in case of NSAIDs? Basically NSAIDs will going to inhibit the prostaglandin E1, which is required for the mucus production in the stomach. So this was a short class on the misoprostol. In your exams, they can ask about which analog does misoprostol belong to, and what is the mechanism of action, where it is used, and what are the contraindications. Thank you.